Awesome. So again, I am Brianna, the president of the GVHS Medical Society, and we're really happy to have you here. So we could go ahead and get started. So please join me in extending a warm welcome to Dr. Vladimir Sinkov, an esteemed expert in adult spine surgery. Dr. Sinkov was born and raised in Russia until the age of 16. He finished high school in Kansas. He obtained his bachelor's degree in biochemistry with honors from the University of Kansas. He went on to earn a Doctor of Medicine degree from Johns Hopkins University, which ranks number 2 among all U.S. medical schools. I think that's really awesome. I've heard a lot of good things about Johns Hopkins. Dr. Sinkov began his practice in 2010, specializing in minimally invasive spine surgery techniques, becoming a leader in his field. He trains other spine surgeons across the U.S., including robotic spine surgery. Dr. Sinkov has published many studies and articles in peer-reviewed medical journals, surgical textbook chapters, and online publications, showcasing his commitment to advancing the field of spine surgery. Dr. Sinkov also is involved in the design, the development, and the testing of multiple spine surgery instruments, including the spine surgery robot Excelsius GPS. With a wealth of knowledge and experience, Dr. Sinkov brings a unique perspective to Sinkov Spine Center, where he focuses on adult degenerative spine problems. We are so honored to have him join us for a fireside chat with the GVHS Medical Society. Dr. Sinkov, could you walk us through a typical day in your practice as an adult spine surgeon? What are the main tasks and difficulties you encounter on a daily basis?
So as a surgeon in general, spine surgeon in particular, there are basically two types of days you're going to have. You're going to have a clinic day or a surgery day. Clinic days when you see patients in an office, either new patients that are coming in with new problems and you need to evaluate them and decide if they need surgery or what else they need, or follow-up patients, the ones that are going through some kind of treatment or the ones that already had surgery. Now you're basically checking them, monitor, and make sure they're healing properly from the surgery. So a typical clinic day would be office hours where patients come in typically between 8 in the morning and 5 in the evening. We have an hour break for lunch. And you see patients, then you document what you saw, saw them for and what you did. So you have to dictate notes. And do whatever needs to be done for these patients, order MRIs, order medications, arrange for surgeries, things like that. So that one's fairly routine. Office day would be fairly similar to most specialties, not even surgical specialties. And then much more unique would be the surgery day, where you actually get to do spine surgery. Typically starts a little bit early. Most surgeons start at 7:30, and meaning 7:30 the actual surgery starts. So you get to the hospital around 6:30 or 7, see the patient, sign all the paperwork, make sure everything is ready in the operating room. Then you do surgery. With spine surgery, on average, you can do about 2 or 3 cases a day, maybe more if they're really small cases, but most of them take long enough where after 2 or 3 cases, you're done. In terms of when you finish, it really depends on the surgery. Some surgeries are fairly quick and you get finished at 2 o'clock. Some surgeries are really long. You're there till 10 o'clock, especially if complications happen. Unfortunately, as you probably have heard from other surgeons, the only way to avoid having complications from surgery is to never do surgery. They will happen in best of hands. We do our absolute best to never let them happen, but sometimes they do. So that's always obviously a worry in the back of my mind whenever I do a surgery. What if something goes wrong? And I do everything I can and prepare as well as I can to avoid that and give my patients the best outcome. So that's basically in a nutshell the 2 types of days I have. And then in the evening, when you get home, depends on what else you have. Sometimes there's more paperwork to do, more charts to dictate. So a lot of times I come home, have dinner, spend time with the kids, and then go back to the computer and do more work. So depends on workload.
Thank you, Dr. Sinkov. I really agree with that too, especially with the 2 different days, because our last fireside meeting, our doctor said kind of the same thing, how as a doctor, your days are very touch and go. Like I think he had an example where a patient didn't have her ride, so they had to wait an extra, I think, 2 hours for her ride to get there. So it could be complications. It could be a simple situation like that. It's very touch and go. Awesome. Yeah, so we could get started with number 2.
Hi, I'm Amy, your Vice President. Dr. Savak, with your experiences in minimally invasive and robotic spine surgery, how do you envision this shaping the future of spine surgery, and what makes these advancements so exciting in medical professionals?
So, great question. When I was training to become a spine surgeon, and before started training in 2008, 2010, things like that. I graduated from spine surgery fellowship in 2010. Minimally invasive spine surgery was still just beginning. So the difference between regular surgery and minimally invasive surgery, what minimally invasive imply is that you achieve the same goal of the surgery, but with less collateral damage to the body. So, for example, in general surgery, for a very routine general surgery is to remove a gallbladder. It used to be a fairly traumatic surgery with about 8-inch incision on your right flank, where that's how much they need to cut to see the gallbladder and remove it, and you stay in the hospital for a week just recuperating from that. They have since moved on to laparoscopic cholecystectomy, where they now can do the surgery in an hour through 3 incisions that are 1 centimeter each, so about a third of an inch, and the patient goes home the same day. So the same procedure, they've removed the gallbladder, patient's feeling better, but a lot less collateral damage. So spine surgery has been a little bit behind general surgery in terms of minimally invasive. The reason for that is the spine is in a very precarious place. It's really deep in the body. There's no easy way to get to it, either through the back, through the side, or through the front. You're going to go through some kind of structures. And there's really big blood vessels and nerves near that. So you really don't want to go in there blindly. You want to see what you're doing. So designing minimally invasive spine surgery has been fairly difficult, but we've been able to do that better and better. So now, for example, so when I first graduated, I did traditional open spine surgery. So let's say for lumbar fusion, it's a 1-hour surgery. The patient would lose about half a liter of blood. They stay in a hospital 3 to 5 days just to recuperate. Now that I know minimally invasive techniques and fairly good at them, I can do the same surgery, but instead of making one big incision causing a lot of bleeding, a lot of pain, I make a lot of small incisions. I use a lot of extra technology to make sure that I do this safely and don't injure those blood vessels and those nerves. And now I can do surgery in about the same time, sometimes a little bit longer just because it's trickier, but the patient goes home the same day, even the next day, or sometimes even the same day. They have a lot less pain. They recover in about half the time. They lose 10 times less blood. They have 5 times lower chance of infection. So it's a lot better surgery for a patient. So that's where minimally invasive surgery comes in, and robotic surgery is basically a form of minimally invasive surgery. A robot makes it easier to do surgery in a minimally invasive fashion without exposing myself or the patient to too much radiation. You don't have to shoot as many x-rays during the surgery. So my hope is, and not really my hope, the goal, and it's slowly getting there, is that minimally invasive spine surgery will eventually become standard of care. Everybody will be doing it that way. We're not there yet, but more and more surgeons are training in it, and I'm trying to help in it. I train other surgeons how to do it. I speak about it at conferences to promote it. So we're slowly getting there. So in terms of the significance for the future, in the future, spine surgery will be less invasive, therefore less scary for the patients, so they'll be more willing to get the surgery done for what they need the surgery for, without the fear of complications and without the fear of long recuperation and a lot of pain after the surgery.
That sounds like it's really helping. I can't wait for it to be fully minimally invasive. So that way, like, there's no, I shouldn't say none, but less complications.
Mm-hmm.
I can't wait for your project to go well. Thank you.
Hi, I'm Basil. I'm the secretary. Dr. Sinkov, as someone who trains and other spine surgeons in advanced techniques, what what advice do you have for high school students considering a career in medicine, particularly in spine surgery? How can they best prepare themselves for challenges and rewards of this specialized field?
Sure. So probably the best advice I can give is kind of know what you're getting yourself into. For me, the decision for getting into medicine was fairly easy. Both my parents were doctors, so I've always kind of been immersed in that, so to speak. So I wanted to be a doctor since I was 5 years old. So for me, that decision was fairly easy to make. All decision was made. I was just going through the motions, figuring out what is it that I need to do to become a doctor, and then deciding what kind of doctor. I'd probably caution a high school student from deciding exactly which specialty or subspecialty they're going to be. You're going to change your mind several times. For example, when I was getting into medical school, I was absolutely sure I'm going to be an emergency room doctor. In college, I volunteered in the emergency room for 2 years. I loved it. It was exciting, fast-paced. You had to know a lot. Nothing was ever boring. So I was sure about it. And then as I started going through medical school, I really started liking surgery. Then basically it was decision which surgery do I pick. Initially it was neurosurgery that I was going to do. Then I realized I really like working with hardware and tools. That's where orthopedic surgery came in. And then eventually I really got into spine surgery. So I changed my mind several times as I was going through that training. So I wouldn't necessarily commit to a subspecialty or specialty while you're in high school. You're going to change your mind many times anyway. So be a little bit open-minded. But probably the biggest thing to realize, and what I unfortunately have seen some doctors go through, is understanding the difficulties that you're going to face, because everybody talks about the glory of being a surgeon or a doctor. Everybody respects you. You make a lot of money. You're smart. It's great. But the commitment, the sacrifices you have to make to get there and to be a good doctor are fairly significant. For example, after I graduated high school, I had to go through college 4 years, then medical school 4 years, then residency 6 years, then a spine fellowship 1 year. So after I graduated high school, it took me 15 more years to finish all my training and to be able to safely do spine surgery on my own. So that's a huge commitment. There are not that many other professions where you have to learn how to do that profession for 15 years before you actually do it. During that time, you're either paying money to be there, like in college or medical school, or you're making very, very little money. A lot of times, if you really calculate hours, below the minimum wage as a resident or a fellow. So you have to be ready for that. You'll be in your late 20s, early 30s, still barely scraping by, whereas your friends who graduated college with you already making good money, if they went to business school or even law school. So you got to be careful. You got to realize what you're getting yourself into that. The other one, probably the biggest one, is the amount of time you're going to commit to your training and then to the profession itself. Especially if you want to have family, especially if you want to have kids, you're not going to have that much free time available for your family and your kids because of how much time it takes to train to be a doctor. And then when you are a doctor, it's not like your hours get much easier than when you're a resident. If anything, don't work in shifts anymore. You have to be always available. For example, I'm basically on call 24/7 for my patients. So keep in mind that, those are the sacrifices you're going to have to make. I'm not trying to make it doom and gloom, but basically realizing what you're getting yourself into. To me, it's worth it. To me, the satisfaction of treating patients, seeing them do well, seeing all those successes are so worth it that I'm willing to do those sacrifices. And fortunately, I have a very understanding spouse that has stayed with me through all of that and has been very supportive. In fact, my wife is now my practice manager, so she's actually running my practice. So we basically work together now. So in some ways, it makes it easier for her to be understanding. She's in the thick of it with me.
Yes, thank you, Dr. Sinkov. I think it's like every other doctor that we've talked to, they've all said that they've changed their minds about what profession they want to go into. So I think that helps me and a lot of other people like put into perspective of like what they want to do, like when they go later into the medical field, as well as take into account like the amount of hours you have to commit to, the amount of hours and years to commit to actually doing that practice. So I think that's really important to take into account. Thank you.
So we actually have a guest panelist with us. This is one of my members, and her name is Yuniol, and she will be asking our fourth question.
Hi, my name is Enyo. Nice to meet you. So my question is, Looking back on your journey from Russia to the US and now to Nevada, what lessons have you learned about adaptability and resilience that you think would benefit young individuals like us aspiring to pursue a career in the medical field?
One of the great things about being young, the younger you are, the more adaptable you are. The older you become, the less adaptable you're able or willing to become. So that's why, everybody trains to further their career usually when they're young. Yes, there are some people who change their careers and decide to become a doctor at 50 years old. It does happen, but majority of the time it's a lot earlier. So my only advice is, pick what you like and stick with it and work hard and be open-minded. And I mean, yes, I had a very interesting journey. I came to the United States when I was 16 as a high school exchange student. So my parents stayed back in Russia. So I had to kind of adapt to be independent fairly early. But, I can't say, a lot of people said, oh my God, how'd you do it? At the time, to me, I was just taking it in strides. To me, it is what it is. I was open-minded. It didn't seem like a big deal to me. I mean, right now, having kids myself, I can't imagine sending my kid out at 16 years old to live by themselves. But, my parents trusted me with it. I was mature enough to do it. So, I just did it. But yeah, just, be open-minded, be adaptable, and you're going to have to work hard. If you want to become a doctor, it's not an easy thing to do, but I think it's worth it.
I think being open-minded, I agree with you on being open-minded and being resilient, because I also moved when I was little from South Korea to here with my family, and I was not as open-minded and mature. So yeah, I agree with you a lot. Thank you.
Sure.
Hi, so me again. We'll get started with our last and final question. Dr. Sinkov, I have been following your practice on Instagram and have admired your ability to balance your roles as a prominent surgeon, your commitment to continuing education and training, and being a dedicated family person with 2 boys, along with having a child in college. Your ability to showcase your culinary skills as an awesome chef adds another dimension to your already impressive lifestyle. What advice could you give to aspiring medical professionals on achieving this balance in their personal lives?
That's one of the hardest things to achieve as a doctor in general, and probably as a surgeon in particular, is a work-life balance. I definitely cannot say I'm a master at it, but I do try all the time. The only advice I can give, try your best to balance it. It's very easy to get carried away in work. A lot of times I work on weekends because I need to finish some project or review some charts, things like that. And trying to balance successful career and other parts of your life can be pretty tricky. I really got into grilling several years ago, and that's kind of a passion of mine. So I do like to showcase that. So that's probably what you saw on my Instagram account. But obviously, there are other facets of my life that I don't necessarily put there. But I enjoy hiking, spending time with my wife and my kids a lot, working out, fitness, things like that. Basically, the way recommended, the way it was actually recommended to me some time ago. As a doctor, sometimes you feel guilty taking time away from work and doing other non-work related stuff. You've spent all these years training to be a doctor. You spent all this money paying for medical school and college. You have so many patients expecting you to do stuff, and you want to just work. Eventually, you're going to burn out. You're not going to like it. You're going to start hating your life. People around you are not going to be very happy about what you're doing, and that will actually affect your work. So the mind trick that a lot of people do, and I utilize, basically think of taking time off to do things that are not related to medicine and as part of your job, because that's what contributes to overall well-being, keeps your mind clear, keeps you healthy, and therefore allows you to actually do your job as a doctor a lot better. So I consider, for example, working out as, sometimes I really don't feel like it. I'm tired at the end of the day to do that, but that's I consider part of my job. If I do not stay healthy, if I don't stay in shape, I cannot do surgery. It's a physical thing to do. If I don't exercise my mind, it's hard to, use my mind to be a doctor. If I don't spend time with my family and relax and unwind, it's hard to cope with and mentally be able to do cope with all the hard things that come with being a doctor, be it dealing with patients, dealing with insurances, dealing with attorneys, dealing with all that stuff. So think of that as you have to be well-rounded for you to stay a good doctor. So you kind of owe to yourself, to your profession, to be well-rounded, and then at the end of the day, you actually enjoy it too. If that makes sense.
Yeah, totally. I get it. I do agree with that because with everything, it's good to have priorities, but that doesn't mean you can't make time for other things for your personal and like your personal well-being. So I really agree with that. And that's really good advice. I also have a bonus question. What kind of music do you listen to? Do you have any like favorite artists, bands?
I'm very much all over the place in terms of the music. And I don't know how much about you heard about the surgeons play music during surgery. That's one of the things. I don't know if you watched the show Scrubs. There was a episode on that. But I'm pretty much all over the place. I listen to almost everything. Maybe country music is one thing I don't listen to that much. But with that said, I still have Johnny Cash on my playlist. So rock music is probably more preferred, but I'm all over the place. I listen to everything. Interestingly, there was some concerns. There were people saying, well, maybe surgeons shouldn't be listening to music in the operating room during surgery. They need to concentrate. It's such a hard thing to do. How can you listen to surgery? They actually did a study comparing surgeons who do listen to music during surgery and those who do not. Those who do actually had less complications because it just kind of keeps your mind a little bit more level. You're less anxious. Everything just flows a little bit better. So I actually, do listen to, that's probably the only time I do listen to music a lot is during surgery.
Wow, that's actually really interesting. I'm going to research about that later. That's really cool. And I listen to a lot of rock too. A lot of my music taste is in the 80s and 90s, like The Cure, Motley Crue, Black Sabbath, Metallica, stuff like that. So that's really cool. All right. So does anyone else have any more questions before we call it a day?
I'm good.
All right, awesome. Thank you so much, Dr. Sinkov, for being able to make this call. I really appreciate it. I think this is going to be an awesome meeting to go over at our club meeting. So that's really awesome. Thank you.
Thank you for having me.
Have a good one. Bye.
Have a good night.
Thank you.